So I'd now like to pass it to Fareen, who is going to talk about some promising practices to equity based on some work she did, looking at examples of what is happening in the public health sector. Fareen, all yours.
Great, thank you so much. Hopefully everybody can hear me. So firstly, thank you so much for the opportunity. I'm really thankful to the National Collaborating Center to engage and have this platform to talk about this further. I'm really encouraged by the number of people, actually kind of blown away by the number of people on the webinar today. I think it speaks to the interest in this area, the need for change, and perhaps some discontentment with how people are experiencing things on the ground. So I know there's people here from a number of different sectors, not just in public health practice, but also, like we said, from the corporate end of things, HR and various things. And I really encourage people to participate. Put your questions forth. This is supposed to be a safe place for questions. If there's disagreement, I think it's important we all talk through this. I don't think anyone's any single authority on what's the best way to move forward. So please do participate, and thanks for joining in. So as Sume mentioned, I am currently working as an associate medical officer for the region of York, which for people who don't know is just north of Toronto, consists of 9 municipalities. And I do want to first acknowledge that York region extends over land originally used and occupied by the Indigenous people, and our closest First Nations community is the Chippewas of Georgina Island. So I do want to provide a little bit of background information before we get started on how this work came about. And I also want to say that we did have some questions come in advance, and a lot of them were centered around what are practices, what are emerging things that other organizations are doing that maybe your own organization can adapt. And so that's really what we're aiming to explore here. I don't have all the answers. We did a bit of a literature review, gray literature, and talked to several key informant interviews from across the country just to get a sense of how things are working in their own organizations. Not much of this is widely published, especially in the Canadian literature, nor is there thorough evaluations done on all the things I'm going to talk about, and some are ideas. So really it's a starting point for discussion. I also think it's really important if people have experienced similar initiatives or ideas or these kinds of things that come up in your own organization, there is going to be time at the end to chat through how did that play out, and feel free to just keep on writing things down in the chat box and explaining, oh, we thought about this here, or this didn't work for this reason, or this worked well in this way, because it really is context dependent, and there's not really a blanket set of solutions, I would say. And even though things are being done, I'll talk about this later, but we're not seeing huge changes in representation, so I think it's important to unpack why that is. So, Sume mentioned, so this is a long introduction for one slide, but just bear with me. Sume mentioned that some of this work got started, and it was more in an academic capacity. I had an MPH student working with me, Nagma, who I see is on the line. Thanks, Nagma, for participating. She did an immense amount of work, as did one of our students, Umkur, medical student at Queen's. And like I said, we dug through some literature, talked to a bunch of people from across the country to get a sense of what was happening. I practice in the Ontario context, and so many of you in Ontario will know that a couple of years ago, the ministry introduced a new foundational standard on health equity, which is part of the Ontario Public Health Standards and what health units at the local level will use to guide their work. And what myself and a few colleagues felt was not explicitly mentioned in those standards was really the need to look critically at our own organizations and our policies and practices and see if we are, or examine and assess if we are complicit or not in this process. So really we have to walk the walk. I mean, we're agencies that tend to really care about social justice matters and health equity, and I think we can serve as role models as employers as well. And so these conversations should be happening in our sectors, especially as people who really, care about these types of issues. So you can see on the slide that we called our project Promising Practices to Promote Equity, Diversity, and Inclusion. I'm not going to dwell on terminology or language too much. But I do want to say a little bit about why that was the case, or why these specific words were chosen. So for us, it was a bit of a practical angle to it. We wanted to use these terms because they're things that people find easy to get behind. They are broad. They mean a lot of things to people, and it's sort of accepted in like the business literature, this whole idea of diversity and inclusion. I have a few caveats to that, though. One is diversity and inclusion are two different things. So just because you have diverse people at the table doesn't mean that they're included or valued in decision-making and participation at various levels. And so that's one thing that we need to keep in mind. The other thing is that what we were really trying to do in this project was actually take an anti-oppressive, anti-racist approach. And that's language that's being used more and more. And in that language is this explicit recognition that there are power systems inherent. Some people benefit more than others. Our own institutions are complicit in this. I don't think we have anything to suggest that the health sector, public health sector is too different in the statistics that Sume talked about. I haven't seen evidence to the contrary, but you know, it's important that we keep that in mind or question whether we are or not different. But yeah, really, it was a bit of a deliberate attempt not to say anti-oppressive, anti-racist, and that may depend on the context that you're in. So that's what I'll say about that. And I see someone saying the slides are not moving, so I will advance them, but that was just my intro to a very long intro for one slide, so sorry about that. This is a framework that in reviewing the literature and in talking to people, we had a lot of initiatives, ideas, interventions that we tried to gather together and theme a little bit. So this is how we ended up theming them. And again, thank you to Nagma for the immense amount of work she did on this. So the goals we had were multifold. So goal 1 and 2 really speak to the need to take stock of your organization on a regular, ongoing basis about how things are with regards to how your employees feel about equity, what the skills are like, and what your practices are like. And goal 3 is about how to nurture a climate of inclusion. And we found the ideas people gave us were related to 3 main areas. So that's recruitment and selection, so how are you doing with actual hiring and retention, learning and professional development. There's a huge focus on training these days. And then our sort of catch-all of area 3 of various things you can do to build respectful, inclusive environments. And then goal 4 we'll talk about a little bit more at the end, but how to actually embed this within the organization and think of this as a culture reset and something that requires quite a bit of time and investment to see a meaningful change. So speaking a bit more to goals 1 and 2, like I said before, this is really about taking stock of your organization and doing that periodically. So there's a number of ways that this can be done. Some are through staff surveys, collecting, opinions from your workforce on how they feel diversity and inclusion is playing out, what their perceptions are of it in the workplace, what skills people might have to advance this area, and then talking about collecting, demographic or identifying information to see how representative is your workforce and your leadership or boards compared to the community in which you practice. And then there's also more formalized assessments that organizations can use to look at this in a more systematic way with tools, and I'll give you an example of one of those a little bit later on. So this whole idea of collecting staff demographic information is definitely a tricky one and something we had a lot of discussion with in various organizations that we talk to. Before I start unpacking it a little bit further, I want to get a sense from the audience about how you feel about this. So hopefully I can make this whole thing work. Oh, good. Okay, so I'll read it out. I feel the following way about collecting demographic data on staff in the organization. So I feel the harms outweigh the benefits. I see the value, but not sure the best way to go about it. I see the value and think it can be done in a thoughtful way, or my organization already does this in some way, shape, or form. And hopefully we'll hear from those folks in a little bit. I'm going to do a few votes. Okay, very interesting. I think a lot of people tend to see the value and think it can be done in a thoughtful way. Some don't see the best way of moving forward on it. You know, I think people are always concerned about unintended consequences, which definitely is something to think about. Perfect. Okay, that's back here. All right, great. Thank you for participating. So definitely a lot of things to consider with this one. One of the things that's very important is your organization should have a good sense about why you're collecting the data and what you're going to do with that, and then clearly communicate it if you're collecting it. So people want to know what you're doing, why you're collecting it. There is an example from the Toronto Central Lynn that had this campaign. They were trying to collect racial data from people that they serve, so beneficiaries of their programs. And they had this slogan of, we ask because we care. So it was a way to tell people that, you know, we're planning to do something about this, we're asking because we really want to know and we care about equity and these outcomes. And so I thought that was a nice, catchy example. People tend to be very nervous about the collection of this information, and again, goals can differ depending on your organization. So, you know, for some, they want to know, is it representative of our community? For others, they want to know, well, what's our baseline and how is it changing over time? And all of those could be acceptable goals. I think, you know, there could be unintended consequences if it's not done in a thoughtful way. So a lot of people advocate for this type of thing to be anonymous, ideally not linked to HR data because people might be nervous. And you might want to take stock first and see if people even feel safe disclosing that information, and asking a smaller group of people if they do feel comfortable, and hopefully leaving it as an optional field. And then you get into how do you actually collect it and what do you want to ask, because there's lots of dimensions of equity that you could measure. People self-identify in different ways. Even if you're trying to break down race, ethnicity, is it going to be an open text box? Are you going to categorize? There's lots of things to be thought through with that. But I think one of the most important is it has to be safe to do so, and it has to be a clear rationale presented to people. Those are all things to think about. This I found is a really good resource. So it comes from Ontario's Anti-Racism Directorate, and they put together some guidelines for how to collect data on race. They typically apply it for if you're working in various sectors and using it on beneficiaries, but I think the same principles can really apply if you're collecting information about your workforce as well. So it's a good resource, and the link, as you can see, is at the bottom of the slide there. And again, we can definitely have more discussions about this at the end too. I can see a bit of activity on the chat box with regards to this. So please do, you know, we can reopen that when the discussion starts. Thank you. Okay, so as I mentioned, surveying staff, having focus groups, getting that input is valuable. There are also these systematic validated organizational tools that can help in this manner as well, and I've come across a couple of examples of those. This is one of them. So this is a tool that is a US-based tool. It came out of Oregon in the child and youth sector. And really the purpose of this tool was to help organizations working in that space gather baseline data and information so that they can, in their own organizations, figure out areas for improvement, and highlighting specific actions that will lead to improved outcomes. So this tool was good because it helped have the organization look at both themselves internally and what they're doing with their own staff practices and hiring and various things like that, but also about how they were serving their community. So a lot of these tools will have both that internal and external aspect to them. So I'm going to show you a few of the examples of questions that they ask organizations when they're doing this kind of self-assessment, specific to the internal environment. But just like with any tool, it's a starting point for discussion. I think you have to have a willing team that's dedicated to actually unpacking these questions of, well, how does racism show up here? How does it play out in our organization? And it could be a very difficult thing to look at critically because it might be practices or policies that your institution has had for years and never really thought twice about. So getting folks who live that every day to see things in a different light can be difficult. and sometimes having this type of objective set of tools or questions to ask can be helpful. So I'm not going to read through all of these, but these are just examples of questions that are asked in this tool. So, one example is, do you collect the racial, ethnic, and linguistic makeup of your board? Do you have it in your strat plan that you have this commitment to racial equity? Do you have this included in performance appraisals so it's built in and there's accountability for some of this work if people are doing it? These are some other examples of these questions. So, is there cultural competency training? We'll talk a little bit more about training as well. Do you encourage or support difficult conversations about race in a safe space? So that often is one of the most important things you can do, is actually foster that conversation and ask people how it plays out for them. Okay, great. So, so those are some examples. So I talked a little bit about goal 1 and 2, which is that whole assessment piece. Goal 3 in our framework was this whole idea of nurturing a climate of inclusion. And like I said, there was 3 themes related to that. So recruitment and selection, training and development, and inclusive and respectful environments. So just focusing for a moment on the recruitment and selection piece. This is very fundamental to the work. It's hiring for diverse thoughts and opinions and people from different walks of life. And so what are ways people have used to actually do this? So one is broadening their recruitment efforts. So, maybe you're posting on community boards and community bulletins in areas where you might want representation or more representation. Expanding student or summer internship programs. We know that when people do a practicum, say, at an organization, they're more likely to get hired into that. The federal government does have some programs where they specifically hire students for internships of, visible minorities, women, people with disabilities, and Indigenous people. And then another one that I think is becoming more popular, just very anecdotally, is this statement of commitment to diversity and inclusion on an actual job posting to let folks know that we're open to hiring diverse people, and we encourage that in an organization, and hope that those values align with candidates that they're seeking out. This, again, the wording would have to be thought through. It's very organization specific. But I do have an example of one that is used with the government of Nova Scotia. So for those who may not be on the webinar but on the phone, I'll just read this out. An interesting example. So our goal is to be a diverse workforce that is representative at all job levels of the citizens we serve. The Government of Nova Scotia has an employment equity policy, and we welcome applications from Aboriginal people, African Nova Scotians, and other racially visible persons, persons with disabilities, and women in occupations or positions where they are underrepresented. If you are a member of one of these equity groups, you are encouraged to self-identify on your electronic application. So a specific example, and in an area where there is an employment equity policy, and that's being called attention to. But, and a lot of people have this, in the Ontario context, there's AODA, Accessibility for Ontarians with Disabilities, and that tends to go on job postings as well. But there are some really interesting examples out there of people that have said, we really encourage applicants, or these are some of our values in our organization, and trying to recruit for people with similar values or thoughts. So, moving on. So like I said, we talked about this hiring retention piece, and we'll talk about that more in a case study we have coming up as well. And then that second theme is the idea of learning and professional development or training in this area. And so a lot of organizations, and particularly I see this in local public health units across Ontario, is this idea that training on diversity and inclusion is a foundational component of this work, and for very good reasons. I think the idea there is to get people up to speed on what is unconscious bias and how do these things play out and what are some of the government policy decisions that have contributed to this. So it's a broad term. I'm just sort of saying diversity training, but really it does include things like unconscious bias training, cultural awareness training, safety, all those kinds of things. So sort of a catch-all term. Now, if you look at, there's a lot of U.S. literature on this. I found some stats that 2/3 of mid-sized companies in the U.S. do this. All of the Fortune 500 companies do some form of diversity training. But interestingly, we haven't seen too much of a shift in representation in leadership positions and representations organizationally, or these racial equity outcomes getting much better over time. So I think we have to think about, well, why is this the case? That people are more, it's just like any health promotion intervention, that education piece is not always enough, and it too has to be done in a very thoughtful way. So there are some articles that I found that actually show that if you do this type of training in certain ways, it may actually worsen attitudes and behaviors towards, minority people in the workplace, and that is something that needs to be kept in mind. So it can have unintended consequences. So for example, if organizations do this in a reactionary way, so maybe there's been a lawsuit or some kind of problem at work, and it's this reaction to, we better get everybody trained, that tends to be seen by staff as very punitive, and they can have this visceral reaction of rebelling against that and saying, well, why am I here? And actually having those values and attitudes reinforced even more, those biases reinforced even more. The same thing with if you get people to have this training be mandatory. People really don't like the idea of mandatory training. I think a lot of organizations use it because you also have that, on the flip side, you also have the problem of people that are motivated and already think about these things are the ones that participate in them to begin with. And so that is a challenge. But the idea of making it mandatory can at times, or is shown in some studies anyways, to have this reverse effect and really get people's defenses up. Any training needs to have enough time dedicated to it. It can't be a one-off training. People will do these before-after surveys, and right after the training, their awareness of cultural bias is really great, and then you do the survey a week or two later, a month or two later, and all that knowledge is not retained. And so it needs to be reinforced. And it really needs to go deeper than just exploring a bias at an individual level and unpacking that and talking about what stereotypes you've heard and what biases you may hold. It really has to go deeper and address the more systematic issues. So talk about, well, what are the policies and institutional practices that people aren't even aware of that perpetuate this? What does our own organization do to perpetuate this? And what are those systems and historical legacies that are resulting in what we're seeing today? So it really needs to go deeper than that one-on-one unpacking of biases. All right. So, so that's a little bit about training, and I know I'm running through these examples quickly, but again, I'm hoping we're having some rich discussion at the end about this. Other things that people have done that we came across that organizations are starting to do or exploring, or that we found when we were chatting with people across the country, is nurturing a climate of inclusion in the workplace. So these are things that foster, this is sort of the catch-all, fostering a respectful and inclusive workplace. So put up a few examples, and many of these are not new things. You've probably seen organizations do this quite a bit already. Some of them are, I could find a little bit more in the evidence or literature about it compared to others. And I know a lot of people's concerns with some of these things are, how do you make this sustainable? They can't just be token things or checkmark boxes that, okay, we've now changed all of our email signatures to include personal pronouns, we're good to go. I think, again, these are intended to be things or tools that you can use, but they should be multi-pronged, and they should come from staff engagement, and there should be rich discussions around, well, why are we doing these things, or why are we not doing them, and who do they leave out? So these are just some examples. I know there's been lots of rich discussion about land acknowledgements in the past, the process you use to do it. Do you just do it versus, engage with the community and for meaningful change and actually unpack some of your own institutional practices that may cause harm? So these are some examples. One that I wanted to focus in on a little bit more, because there's quite a bit of evidence around it, is this idea of mentorship and sponsorship programs. So this is written about a lot. There's several articles I came across in Harvard Business Review, and it's been shown to advance racial equity. So the idea here is that you offer mentorship programs to everyone in the organization, and it has a few beneficial impacts for several reasons. So just like Sume talked about, that professional networking, seeking out your own mentor, that social capital, people newer to the country, women, minorities, these folks and other equity-seeking groups actually tend to be at a disadvantage with that in terms of finding those relationships organically. At the same time, there's been surveys of corporate leaders, and many white men in leadership positions find it challenging to approach women, for example, in that environment informally. So having a formalized mentorship program can go a long way with this. And there's also been some data showing that women and minorities actually sign up for these programs a lot quicker than other people, and so it tends to benefit them a little bit more. Beyond mentorship, of course, is this idea of sponsorship. So, mentor might be someone that meets with you every few months and talks about career goals and things like that, provides some advice, whereas a sponsor does a little bit more than that. So it's more about advocating for somebody that you're mentoring or sponsoring to have opportunities, advocate for them to present at a forum or be at an important meeting or advance up the ladder. And that's really what a sponsor is. And these things have shown, again, a lot of it is U.S. data, but to increase the representation of minority populations and equity-seeking groups in various institutions in the private and public sector. And I'm just going to leave that quote up. I won't read it out. Now, we've talked a little bit about sustaining the work and what are all the things that are needed for this to not just be a one-off approach or to not be just a tick mark exercise. And I think that requires some discussion. Would be really interested to hear how organizations that are doing this well have been able to sustain momentum. So in speaking to people, these were some of the themes that we came across. It really does need commitment from the senior leadership and really at all levels. It can't just be top down and it can't just be bottom up. It has to be, commitment at every level. And this other thing takes a long time. It's not necessarily, it's a whole culture reset. It's not something that's going to take a couple of years to improve. It may take decades or even longer. It's something that is a long haul and it needs to be resourced. The idea of accountability came up, so there was a lot of talk of, embedding these kinds of skills and projects into people's performance appraisals and work plans and having that really embedded in the day-to-day work. It should be a multifaceted approach, and there should be a clear vision that's communicated to all staff. So again, that rationale piece is very clear to people about what the ultimate goal is and what you're striving for. I guess one thing I want to say here about this being a culture reset and a cultural shift in an organization is the assumption of, hiring or bringing on and including diverse people is that they'll bring with them diverse thinking and new ways to approach problems. And ultimately that's, in the private sector recognized as good for business and really good for service as well, even if you're in the public sector. And so there is an inherent value ascribed to that. But we can't just be hiring for folks and having people sit at the table. We have to really go farther and dismantle and look at systems of power in our organizations and have those critical conversations with people, because it's not just about having people at the table. Like there's a lot being written about and talked about how equity-seeking groups may act one way at work and another way in their home and personal settings. And so how do we actually make it safe for people to bring that diverse thinking and different ways of speaking and knowing and being in the workplace, so people are not all socialized in the same way in an organizational environment, so that, you walk into any room in a conference call to conference call, people are speaking the same way, their intonation is the same, the dressing is the same, their hair is the same. And so, how do you actually make it so that that diversity is actually celebrated and seen as very valuable? So I have a little visual about some of the spectrum of this type of work. It is from a private sector. Sume and I were looking for something from the public sector, but I guess we didn't dig that deep. So if anyone has the examples, please do share it in the chat box. So this comes from Deloitte. And it shows that there are different ways and different spectrums of doing this. So you might see some of these practices in organizations, but I think you really have to ask, are they there on the surface? Is there a real commitment from all across the organizations to looking at unpacking policies and practices and being critical of your own institutional roles and models? So, on the one extreme, You have organizations that maybe there's been, they're taking a very risk-based approach to this of, okay, we don't want to get sued and we don't want human rights complaints, or maybe something has happened, so we throw in a bunch of trainings, we change our email signatures, what have you, or this is just the norm now, so people do it. Versus on the other end, where there's a real commitment to unpacking what's going on, how does racism play out, how do various people experience it, a commitment to change, building it into the strategic planning, the vision for the organization, hiring for that, training people for that in an ongoing and meaningful way. And so this can look very different depending on the organization in which you practice. And I guess the point really here is it may not just be enough to do some of the examples we talked about. I think there has to be that systematic look and acknowledgement and recognition that we may not be that different in the health sector, and probably every institution has a way that this plays out for people, and that needs to be looked at. So I recognize that there are lots of challenges to implementing this type of work. Discussing with various people, we heard like legal concerns. There might be concerns with collective bargaining processes. There's all these types of things that get in the way. And so we're curious to hear from the audience of what you see as the biggest challenge to implementing some of these interventions. So perhaps what you could do is type this in the chat box. Maybe you've tried some of these things, maybe you've started the discussion in your own organization. So what is the biggest barrier that you face? And I'll read them out when they come up. All right, so we have a lot of lip service being paid and not enough attention to implementation. Yeah, exactly. So, like actually engaging with some folks in the corporate services side of things, for example, to say, like, well, what are some of these things? Are they feasible? How can you overcome or find solutions? So, yeah, definitely we've got sustainability of these interventions is a huge challenge. Accountability, like we talked about, accountability to the employment equity policy. Cost, I think that's a great one. Time, resource, having that dedicated space to think about these things, to move it forward, have conversations, especially when you're in, a large organization. It's bringing people together, even at different departments, can be challenging. I see hierarchy within the organization. Yep, that makes bringing forward difficult ideas very hard. And yeah, this is a good point about it now being fashionable, so everyone's doing, a land acknowledgement, or everyone's doing these pronoun things, so let's just get behind it so we look like we're moving ahead in this area. And it may not require any deeper digging, but it should. Yep, the idea that change is slow instead of making bold changes. So what are small things you can do over time if that's your purposeful vision? Measuring success, definitely. Convincing people that maybe you're not diverse, right? And what does diversity actually mean? How do you measure it? Are there hidden elements you can't tease out? For sure. Resistance to change, yes, exactly. So that's great. That's basically what I had as well. So lots of challenges. There is resistance to change. I think that's a very human thing. Asking people to look at stuff that they've been involved in for years is difficult. Like, it's hard to see that with an objective view because you're really tied to your organization. You have a lot of pride in your organization, and that can be a good thing. So asking those questions without irritating people really is a skill. Discomfort with the subject area. I think, Sume and I were chatting a little bit about how people, like sexism is a very okay thing to talk about. Everyone accepts it. Racism, maybe not so much. It's really hard for an organization to say, yeah, we're racist. Like, it's not really something you hear. Organizational perspective. So, we talked a little bit about collective agreements. One of the things that had come up in our discussions is even our days off and holiday policies, they're very Eurocentric. You don't necessarily get days off for Eid, for example. Sume and I were talking about bereavement policies. A lot of the times they're for your direct family member, and you maybe get 5 days off. Well, you could live in a different family structure where maybe your aunt raised you, and if that person passes away, you don't get the same leave. And so A lot of this is really difficult, and many of us work in a very unionized workforce, and these things are bargained for with units that represent the majority, and so and you have to stick to them, right? There's consequences when you don't stick to it, so how do you really navigate that? A lot of organizations, particularly in the public sector, are quite risk-averse, and there are risks of unintended consequences, but that doesn't mean you think through every possible aspect, and there might be a downfall, and sometimes you just go with it. That doesn't mean you do it without thinking through, but I think some people get really fixated on making it the perfect product, and that can be hindering as well. And then the time and resource requirements for sure. So this is a good resource. So when we were doing this work and asking people within our own organizations and other places, what do you do, what do you think about, there were a lot of counter narratives that came up to not necessarily accepting it's a problem, and some of the challenges that people typed in that chat box. And so this is a good resource to counter the counter narrative, and so I encourage people to take a look at it. We don't have too much time here to discuss all of that, but the link is on the slide, and I did find it a helpful thing to read through. Okay, so moving on to the case study, there's quite a lot of great activity in the chat box. So we're going to spend a few minutes on this case study and then open it up for wider discussion and get a sense from people who are listening what they might have tried and what barriers and enablers that they've come across. All right, so this is the case that was presented. I'll just read it out, and then I'm going to pass it over to our team here who did some great work in unpacking it and starting the discussion off for people. So the situation is, you are a hiring manager working closely with human resources to bring on a team member to your chronic disease prevention unit. Your public health agency has been doing a lot of work in the area of organizational health equity, yay, and the idea of anonymized resumes, some people call it blind resumes, has come up to reduce the inherent bias in the selection process. So how do you advise your team on how to proceed? So what are the pros and cons of this type of anonymized resume, and what might be some of the unintended consequences?
Okay, before we go into answering some of these questions and looking at what we found as we were unpacking this, we just wanted to start with sort of a broad definition of looking at what anonymized resumes were. It's any technique that takes away personal information about a candidate from a recruiter or hiring manager that can lead to an unconscious or even conscious bias about the candidate. This bias tends to be unfair and discriminatory because there's much personal information that is presented and is generally unrelated to the person's job performance. Anonymized resume is intended to increase workplace diversity by allowing recruiters and hiring managers to be more objective when evaluating a candidate's skills, knowledge, and potential to succeed, while remaining free from biases related to the candidate's race, gender, age, education level, or any other factor that may result in hiring bias. The practice can gain more acceptance as part of a larger movement to remove faulty human judgment elements, such as unconscious biases that can interfere with hiring people that were initially truly the best candidates. For this case study, the technique we're looking at applying is to resumes within the hiring and selection process, and we'll provide some of the potential unintended and intended advantages and disadvantages to this. There are various ways to anonymize resumes. For example, candidate names which can identify gender and ethnicity can be removed. However, anonymizing can extend to other identifiers such as age, cultural affiliation, sexual identity. For example, for age, we could remove the dates of work experience and graduation dates. Organizations can unintentionally introduce bias to hiring based on what identifiers are anonymized. So looking at the potential benefits to this technique, the intentional positive ones are there's a real advantage of an anonymized resume that makes it a candidate's skills the first impression for the employer versus favorable or highly preferred traits and background that may be identified on a candidate's resume, such as university, gender, race, ethnicity of previous employers. Anonymized resumes can promote greater diversity within the workplace as screening biases are reduced. They also decrease opportunities for nepotism practices to occur within the workplace too, which could benefit newcomer and new immigrant populations as they may not have as many social connections when they are seeking employment when someone who's settled in the region or country for a far longer period of time. We see it reduces disparities between candidates across the SES gradient, providing equal and equitable opportunities for all potential participants. For example, white-sounding names are 75% more likely to get an interview than Asian-sounding names. 40% are more likely for males to receive interviews than females. And a study that was based on the Boston Symphony Orchestra first introduced the practice in 1952. They found that most orchestras at the time employed nearly all white men. Blind auditions targeted diversification by removing focuses from everything but performance. A racial discrimination case was brought against the New York Philharmonic in 1969, which led to changes in the 1970s where many orchestras employed blind auditions. A follow-up study to this showed that blind auditions increased the chances of women being hired by 25 to 46%. However, it is unclear if minority groups, including racialized women, experience an increase in hiring. Oftentimes, white women have been the beneficiaries of employers' equity initiatives. There's a large representation of white males in leadership positions, and anonymized resumes have the opportunity to put a process in place to challenge the status quo versus continuing the process that reflects and reinforces general or archaic practices, such as those related to race, gender, and status. Anonymized resumes is also an opportunity to eliminate an organization's from discriminating specific candidates based on cultural fit, whilst increasing diversity across the organization. As we move into the cons, we can see recruiters have unconscious biases that influence decisions within the interview or in-person process. You may be delaying the bias in hiring to the in-person part of the process if this type of bias is prominent within your organization. Therefore, as discussed before, we need practices and policies in place that promote fair and equitable practices throughout the hiring process itself. Inconsistency in the practice of anonymized resumes leads to questioning how much anonymizing is enforced. The organization's decisions of what information and details will be retracted on resumes can still influence existing unconscious or conscious biases. This practice can increase diversity within the workplace, but inclusion in the workplace needs to be fully supported. Having diversity in the workplace does not necessarily ensure that all members are included or respected in decision-making or valued the same way as others, as we discussed. Organizations need to make a full commitment to diversity and inclusion at all levels, and the hiring process is just part of this, and it extends to other internal processes, procedures, and practices. For example, we could hire a member of a minority group to misrepresent a sense of diversity, and this becomes a tokenism of representation within the group that they are hired for. Anonymized resume techniques may have little impact on the hiring discrimination based on age as well, because of the multi-age-based cues that could act as identifiers, as we discussed. As we flip into looking at the unintended consequences, positive ones is that there's an opportunity for HR to build their capacity on the health equity, specifically around anti-racism and oppression and white privilege. Health equity should be embedded within human resources practices. An increase in understanding how hiring processes can influence the SDOH, such as employment and income, can shift recruitment and retention practices that are rooted in equity and inclusion. Racism and oppression underpins health equity, which demonstrates how it can intersect with the various SDOH conditions that impact individuals and communities. Exploring unconscious bias within the hiring process is another facet which moves organizations closer to achieving equity. This has to include equitable practices throughout the employment experience and could be coupled with a systematic approach that examines the policies, practices, and operations of the institution. Encouraging workplaces to collect race-based data for their organizations can have the ability to demonstrate commitment to diversity and inclusion hiring practices using qualitative data. Now, looking at the negative unintended consequences, we see it can hinder diversity in hiring because many organizations seek out minority candidates in the hiring process as part of their commitment to affirmation and action. So in workplaces where this is the case, it actually can have the opposite effect. Diversity and inclusion strategies can create a divide between groups within the workplace, as we discussed, contributing to an us versus them mentality or hostility within the workplace due to the lack of understanding of other people's beliefs and cultures, as well as ethnic stereotyping. One other big one, I think, is that for a lot of people, belonging or lending to groups that could identify you as a member of an equity-seeking group, such as LGBTQ student group or something similar to this, is a big part of their identity and who they are as an applicant and what they bring to the table. So to whiteify a resume, you can lose the individual flavor of that candidate, and so may even reduce diversity in the workplace, which is a loss. It's sort of related to the first point of hindering diversity in hiring. And the big one is the power remains unchallenged and Eurocentric norms remain the same. We do acknowledge, though, that the evidence is very mixed around this area. The pros and cons discussed in the above here that we shared just scratch the surface in terms of what anti-discrimination practices there are. What stands out is that the organizational context can improve or hinder the process on racial equity. How organizations choose to operationalize, determine intervention, and apply diversity and inclusion policies and processes requires both critical and thoughtful reflection regarding inherent Eurocentric biases.
That's great. Okay, perfect. So for the benefit of not talking is I can look at the box, and there are some really great discussions going on. Definitely. So thanks. I just want to re-highlight something. Michael Schwann, thanks for participating. Definitely that is something that we talked about, and as Rachel mentioned, it's really, so evidence is mixed. I mean, we don't see a clear outcome one way or the other. It kind of depends on what organization you're in as to whether it worsens or improves the situation. And it's not really addressing the root problem. And a lot of people that I've talked to anecdotally are, saying, well, why should I take those things out? Or maybe I don't want those things taken out because they're a huge part of who you are as a person. Although there is bias, and maybe it just delays the bias. But if that's not coupled with larger policies or practices, then you're really at a disadvantage there. I mean, it has to be looked at in the greater context of how hiring is happening, how promotions are happening, what's your leadership structure like, and it by itself is not really addressing the root cause. So that was a really good point, and thank you for re-bringing that up again.